A tale of two vaccination realities. The United States faces a growing divide. The United States is witnessing a significant shift in vaccination dynamics, as the once unified approach to immunization is being fractured by state-level decisions and controversies within the Centers for Disease Control and Prevention, CDC. This development sets the stage for a potential reorganization of how vaccination recommendations are implemented across the nation. The growing divide is becoming increasingly apparent, with Republican-led states rolling back or eliminating vaccine mandates, while Democrat-led states are breaking away from the CDC to establish their own vaccination guidelines. This divergence in approaches highlights the deepening polarization around vaccinations in the country. In response to recent events at the CDC, including the firing of Director Susan Manares and the resignation of top scientists, California, Oregon, and Washington have formed a public health alliance to provide credible information about vaccine safety. These states aim to counteract the perceived erosion of trust in the CDC and the controversial guidelines issued by the Food and Drug Administration, FDA. Meanwhile, New Mexico's health department has ordered pharmacies to remove barriers and ensure access to COVID-19 vaccines, echoing a similar move by Colorado. However, in contrast, Florida's Surgeon General, Dr. Joseph Ladapo, has moved to eliminate vaccination mandates statewide, including in public schools. Other states, notably Texas, have also considered rolling back vaccine mandates, with numerous anti-mandate bills introduced in the legislature. The controversy surrounding vaccinations has gained momentum as once fringe claims about health risks associated with vaccines have found mainstream acceptance, particularly during the Trump administration. Misinformation such as the belief that vaccines cause autism or alter DNA has contributed to public distrust in vaccination programs. Historically, the federal government, in collaboration with infectious disease experts, has established guidelines for vaccinations. These guidelines have been crucial for states, medical organizations, and insurance companies in administering and covering the costs of vaccinations. However, the rise of vaccine hesitancy, fueled by misinformation campaigns during the COVID-19 pandemic, has turned vaccination mandates into a political battleground. The divide is not geographical, but ideological, defined by state governments' stance on the medical establishment's role in determining vaccination requirements. This rift threatens to create two distinct zones in the country, where attitudes towards vaccines and mandates differ significantly. Health and Human Services Secretary Robert F. Kennedy, Jr. has criticized what he perceives as irrational policies related to vaccines, such as mask mandates for toddlers, school closures, and the suppression of alternative treatments. While lockdowns and school closures had negative economic and mental health impacts, vaccines have proven effective in reducing hospitalizations and severe COVID-19 cases, alleviating the strain on healthcare systems. Despite the availability of vaccines since late 2020, fears surrounding their safety, particularly concerning the novel mRNA technology, have persisted. The uncertainty about long-term health effects, combined with the loss of personal freedoms during the pandemic, has fueled divisiveness over vaccinations. Kennedy, a prominent figure in the anti-vaccine movement, initially adopted a moderate stance on vaccines, but later reversed course. He disbanded a 17-member independent vaccine advisory committee at the CDC and replaced its members with individuals skeptical of vaccines and critical of the COVID-19 vaccines. Additionally, he cut substantial funding for mRNA vaccine contracts. The FDA's approval of a new COVID-19 vaccine formula prompted Kennedy to announce that the CDC would recommend vaccinations only for adults age 65 and older, as well as those with pre-existing conditions. This marked a departure from previous recommendations, leading the American Academy of Pediatrics to issue its own vaccination guidelines for the first time in 3 decades. California, Oregon, and Washington are following suit, aiming to provide unified recommendations based on science rather than politics. These states warn of severe consequences if the CDC becomes a political tool, compromising scientific integrity. In response, HHS has criticized democratic states for policies that eroded public trust in public health agencies and defended the Advisory Committee on Immunization Practices, ACIP. However, without clear federal guidance, states may develop their own public health orders, and insurance companies will need to navigate the evolving landscape of vaccine coverage. The recent turmoil at the CDC, including the firing of Monterez and the subsequent exodus of top officials, has further exacerbated the situation. 9 former CDC directors accused Kennedy of endangering public health and called for congressional oversight of HHS. They urged state and local governments and philanthropic organizations to fill the gaps left by the CDC's shortcomings. Kennedy defends his actions, arguing that the CDC must refocus on its original mission of addressing infectious diseases and restore public trust. However, the ongoing controversies and divisions around vaccinations in the United States continue to unfold, shaping the future of immunization practices across the nation.